Hi and welcome everybody. This is Stephanie Rolón Rodríguez and
Will Schott.
And we are both third-year family medicine residents who are here to present our quality improvement project named Improving Social Determinants of Health Screening and Follow-Up, a clinical workflow intervention. This presentation will be recorded and we will have someone at the end available for any live question and answers. So what are social determinants of health and why are they so important? Social determinants of health are conditions and the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. These are the things that affect our patients the most, right? Are they able to get to clinic? Are they able to afford their medications? Do they have access to health care? 80% of the health outcomes, this is fantastic and ridiculous at the same time, 80% of the health outcomes are due to social determinants of health, when a whopping 20% of the health outcomes can be attributed to our clinical care in the clinic. And so this shows how important it is to focus on these things, make sure that we're taking care of our patients in that sense before they come into our clinics. And that way they are able to, get their clinical care and succeed. Despite various validated social determinants of health screening forms, this is something and processes that are already in place. This is something that we have a lot of missed opportunities for screening, as well as once we get to screening, there's a low percentage of resources that are actually being provided to the patients at this point.
And so where does that leave us? With this in mind, we came up with the following clinical aim for our quality improvement project. The background, a little bit zooming out, was that we had initially taken over a project on closing care gaps. And when we started looking into how we can close care gaps within our clinic, again, thinking about things like hypertension and diabetes and these sorts of things, we realized again that we were only dealing with a fifth of the potential here. And so we wanted to move further upstream. We workshopped with our clinical team and we were able to establish a project aim of updating a clinical workflow, which had previously been established in 2018, to increase both our screening rates as well as interventions addressing any positive responses to social determinants of health screens. And so how do we go about doing this? Well, we ran our resident-led CQI project over the past 10 months. We started in July workshopping and brainstorming, creating workflows, updating resource lists, and really meeting monthly with the entire clinical workflow team, which included MAs, providers, residents, and many more people. Then in 2021, on November 1st, we went live with the project and disseminated a workflow that you can see on your screen throughout clinics and throughout our clinical populations. Our study population were all the patients seen within our family med clinic at the Sugar House Clinic. And our measures were the percentage of patients screened with our 3-question tool, looking at food insecurity, transportation issues, and loneliness. And then how many of these patients had interventions, including resources into their after-visit summary or referrals to care management or social work documented within our EPIC electronic medical record.
So what have we found during our intervention? So as you can see our results here, just like Will just explained, we had two things that we were measuring, both the screening completion as well as patients actually receiving any interventions after a positive screen. After our intervention was put in place in November 2021, we did see an uptick in the amount of screenings that were actually being completed by all of the patients that came in that were due for their social determinants of health screening, which is awesome, as well as we have right here on the right side, the intervention rate changes in each of their categories, both for food insecurity, transportation, and loneliness. The other thing that we'd like to show is that we did see an increase in the patients receiving any type of intervention, whether it be after visit summary or care management or social work referral. But after a few months after the intervention started, we did start seeing kind of a low trend down of patients actually receiving this. So kind of in discussion of the things that we've have talked about, what the problem that we were trying to get to, and what we found through our intervention is that screening for social determinants of health is critical in our busy family medicine practices, right? We're trying to do so many things, but again, all these things that we do once they come to clinic, it's only 20%, right? We want to make sure that we're reaching, upstream things that we can do to help our patients succeed and be healthier. So some of the challenges that we experienced through our intervention was that, COVID-19, the COVID-19 pandemic has affected everybody. The transition between virtual and in-person visit structures, and then the staffing shortages and turnover made it very difficult for everybody to know, be on the same page with the algorithm, the intervention, and how to go about it. So that was difficult during our implementation process, as well as disseminating the workflow updates, right? We are a large academic institution with residents that are in and out of clinic. And so getting all of that information out and making sure that everybody knows the process was difficult for us. The takeaway points, complex interventions are difficult to adopt in the clinical setting. Again, like I said, we're trying to do a million things with 5 minutes with each patient. And so it is very important to have a highly visible and intuitive EMR process to have the best impact and outcomes in these types of clinics. Also very important to have an interdisciplinary team in addressing, these new and complex problems, because without our awesome care management, pharmacy, social work, behavioral team, MAs, if I miss anybody, I apologize, we would have not been able to, do this. We also noticed that this requires initial and ongoing buy-in from all stakeholders. If we are not, if people up top, are not interested in this or are putting the emphasis on this, it is not going to be able to move forward in improving screening for social determinants of health. And lastly is that, we are a well-equipped institution. We are academic center that is well-resourced and equipped, again, because of our university affiliation. And so we do we noted that this was a limitation for this type of intervention, that it would be more difficult for a community-based practice to do this without the support from a care team like we had.
And so continuing on with a few of our conclusions, we did notice that there's absolutely room to grow within screening for social determinants of health. Even within a few short months, we were able to see our screening rates rise and rise and rise. So we know that it's possible even in busy primary care clinics. Next, we know that workflows do indeed work. The more streamlined and intuitive they are, the better, but they can get people moving in the right direction and moving together in the same direction. Now, intervening on these positive screens was shown to be more difficult and complex, as we noted, and that's something that we want to focus on next. So how do we streamline our resource list to make sure they're up to date and vetted? And then how do we standardize and automate these processes so that our EMRs can work for us in order to get these screenings and interventions into the patients who need them most? So finally, we want to thank you so much and move on to questions and references. The references, as you can see, are at the bottom of the screen, and the QR code at the top of the screen will actually take you to a live copy of our poster on Google Drive where we can receive your feedback. We appreciate all of your time, consideration, and feedback, and want to open it up for any questions, concerns, or comments. Thank you so much.